All right, good afternoon and welcome everyone. My name is Dr. Lucy Marcel. I'm the Executive Director of StreetCred. And today I have with me Alicia Morales, who is our Director of Operations, and Rob Dolliver, who is one of StreetCred's financial coaches. We're really excited to talk about financial coaching today and this service that you as a Boston Medical Center patient have access to, and what it is and why you might want to use it. So before we dive into that, I wanted to take a minute to tell you all about StreetCred. We provide different financial services for families at the pediatric clinic at BMC. So we help families with filing their taxes, with opening up college savings accounts, and with financial coaching. And we do it all because we know that what your financial state of being is really impacts your health. If your money is not in a good state, it's really stressful. It impacts your mental health. It can impact your physical health too, not having enough food at home. And just the stress itself can have negative physical impacts on your body. So as a doctor, I really care about making sure that you are financially healthy so that you can be physically and mentally healthy as well. So with that, I'm going to turn it over to Alicia, and you can tell us a little bit more about financial coaching.
Hello, everyone. So we've partnered, StreetCred has partnered with the Foundation for Financial Planning, so we can provide financial coaching free of cost to you all. And in light of the COVID pandemic, we've brought the financial coaching online, and so it'll be offered virtually to you. So the way that matching would work is, first of all, you would connect with us, and the easiest way to connect with us and express your interest in this program is to send an email to info@mystreetcred.org, and one of our team members will connect with you. And once the team member connects with you, they'll want to know a little bit more about your goal or goals, and as it relates to financial coaching. And just to point out, your goals can be short-term goals, or they can be long-term goals, and certainly they may take place over one session or over multiple sessions, and that it all really depends upon your need, and everyone's needs will be different. And so once one of our team members has spoken with you, they'll match you to a coach who can best assist you, and of course we're going to want to hear about your schedule, so they will ask questions about your schedule and what time works for you. If you have a specific need around language and that you speak another language other than English, we're actively looking to try to recruit coaches who speak other languages. So let us know if that is also a need of yours, and we will try our best to meet that need. One of our team members also, once our team member sets up a first session with you and the coach, one of our team members will join that first session with you for about maybe only just for the first 5 to 10 minutes. And really the purpose of that is just to make sure that, that the conversation is flowing and that everyone's needs are being met. And like I said before, all sessions will be virtual, during this time. And it would be ideal if you had access to a computer or a laptop, or an iPad or even a smartphone, where you can connect via video. Oftentimes the financial coaches will want to share documents with you, and that way you can be looking at the same document together. But certainly if all you have is a phone and that's sort of how you prefer to connect for these sessions, we can make that happen as well. So just let the team member know more about your technical capabilities before the call. So I just want to re-emphasize the fact that we can help with smaller financial questions, and then and the process doesn't have to be super in-depth. I'm now going to turn it over to Rob Dolliver, who is one of our financial coaches at BMC, and he's going to introduce himself and discuss ways that we can offer help and sort of talk us through what a first session might look like.
Yeah, thanks so much, and thanks for having me. I thought, again, I'd sort of comment on a couple of things. First is, what are the types of things that we might cover in a financial consulting meeting? And then what would sort of that first meeting structure look like, just to give people some comfort in how that process would work. So to start, I think it's important to understand that, as Lucia had mentioned, we will help you cover things that are both short-term and long-term. And a big part of that first interaction is learning about those things. So us asking some questions about your current financial state, as well as the things that you want to accomplish over time, so that we can get a good understanding of, number one, where you currently are, what things are important for you, and then ultimately, where do you want to get to a month from now, a couple months from now. And in some cases, it might be a little bit longer term, thinking about education or your own personal financial future, such as retirement, things like that. So we can help you with all of those things. And how we do that is kind of break, your finances into a couple of different components. So first is to start thinking about your cash flow and helping you create a budget. So how do we help you identify how much is coming in? What are the mandatory things that are going out? What are the flexible things that are going out? And how can we help you sort of push and pull different levers so that you can make informed and good decisions about where your money's being spent, how your money's being spent. You might have, a common question that we might get is, how do I manage these debts? I've got credit cards and other liabilities that I have to pay down, and we can help you create a strategy of how to pay those down effectively, how to prioritize them, which one should get paid first, which one should get paid second, and so forth. We can work with you to establish a rainy day fund, just a little bit of money set aside that in case you have a little bit of an emergency, you have something to fall back on, a little bit of money to fall back on. The other, sort of aspect of things is to try and build a little bit of education and some understanding about financial terms and concepts to start to demystify, I guess, some of what it means to financially plan. And it could just be answering common questions like, what's a stock? What's a 529 plan? What's an IRA? What are these different things that I might be able to use to help me plan a little bit financially? And so we can have conversations about all of those different things to, again, I think the goal, just to reiterate, is to help you identify, number one, where you are. Number two, how do we take the, set of resources that you have right now around your finances, come up with a plan for you of how to best allocate the funds that you have. And as Dr. Marcel had mentioned earlier, the goal through this process is to help you, lower stress, because when you have a game plan of how to approach these things, a lot of it we can set to go automatically and systematically so that you don't have to think about it much. So hopefully that helps. I don't know if we're turning it over now for questions, but happy to do that. But yeah, thanks so much.
Yeah, definitely. Thank you, Rob. And we can definitely talk about a few common questions we get now. And it looks like we have one right now in the chat box that says, can I just have one meeting to ask some financial questions I have? I think a lot of people worry about whether this is, a bigger commitment.
Got it. Yeah, of course. No, of course. One meeting is just fine. It can be 5 minutes just to ask one question. It can be a recurring thing. I do think it is important to stress, though, that this is not a one size fits all thing. So it's really about customizing to what your questions are, what your needs are, and us doing the best we can to provide the resources that you specifically need through this process.
Great, thank you. There also is a question about whether you can help with creating a budget. And I would add to that even that, I'm seeing like right now, a lot of my patients don't have reliable sources of income because of the pandemic. They're maybe furloughed for a while and they're coming back to work, and or they were an Uber driver and there is not a lot of business right now. So it might be helpful too to hear about how you deal with budgeting in situations like that.
Yeah, no, of course. So yes, we very much can help and would help with budgeting, helping you prioritize your expenses. And I think when you might be in some type of transition like that, it's important, number one, to prioritize what are the major things that have to get paid and what are the things that you might be able to put off for certain lengths of time until you get back on your feet. So, excuse me. So that's, I think, a big part of it. Specific to the pandemic, there are also a lot of programs out there that the government has put out, and we can help you navigate those and answer some questions. So we do have a lot of information about the federal programs that would support Uber drivers or people that are in, I'll call it a self-employment bucket, that wouldn't normally be eligible for, say, state unemployment benefits and things like that. So there are, I guess, a couple of things. One is, prioritizing, understanding where your expenses need to go, number one. And then number two, are there ways that we might be able to help you bridge that gap through programs that might exist for you?
Yeah, that's great to hear. Thank you. I definitely talk to a lot of families who I think are having a lot of trouble accessing things like the new unemployment benefit programs. It seems like they're very confusing and, running into different trouble. So I think the fact, knowing that you can help answer questions about that could be very helpful for families. It looks like we have another question which says, what if I don't have a bank account? Can you still help me?
Yes, of course we can. I think a bank account is not required for this type of service. There's really no requirement for this type of service, I would say. I think a big part of it is just you having a desire to learn and to think about these things, and being open to having a conversation about it is really the only requirement that we would have.
Great, thank you. And then one more question, do I need to put a credit card on file to join the coaching program?
No, not at all. Yeah, this is a free service. Again, there's no time commitment. There's no monetary commitment. It's a program, through StreetCred in partnership with Boston Med that, we're here for you. We're here as a resource. Again, no questions too small or too big. And we're literally here to do everything and anything that we can to help you, get some financial footing, reduce stress, allow you to focus on the things that are, medically, getting medically well, mentally well, trying to remove some of the other stressors that can impact those things, as you said earlier. Yeah.
Thank you, Rob. And I think that's an important point to emphasize too, is, for good reason, I think sometimes people are skeptical or wondering when they hear something's free, if there's a catch or a gimmick, or is it high quality? And I would just emphasize, and you could maybe talk a little bit more about this, but that you are a certified professional. This is something that you have training and past exams in. But it's only free because this is something that they're getting as a part of their care at Boston Medical Center, that, this isn't some scam where someone's stealing their information. And it's something we're offering patients to help them be healthier.
Yeah, well, 100%. I'm a certified financial planner professional, member of the Financial Planning Association, which is how I've, was connected with StreetCred. I've been doing this for nearly 20 years on a professional level. And again, this is really, truly no catch, no gimmicks, no anything about it. We're here in partnership with Boston Med to, provide financial advice in conjunction with the medical advice that you're getting there. Again, all designed to try and help you reduce stress and just live a more comfortable, healthier life.
That's wonderful. Thank you. And we are, again, so grateful for you all doing this. Last question, maybe, can you help me build my credit?
Yes. So we can, we don't offer credit specifically, which is one of the ways that you build credit, but we can provide guidance and advice about the things that you need to do externally to help build your credit. So it's a kind of, I know it's a yes and no answer to that question. We're personally not responsible for your credit report and you building credit, but we obviously know how those things work and can provide guidance as to what things you can do to help establish credit, improve your credit if it might not be in good standing at this point, et cetera.
Right. Yes. And I think that's, that would be very helpful. I think many people are not aware of the different steps they might need to take to improve their credit scores. Anything else that we didn't ask you about that you think our families should know about coaching, about finances before we wrap up?
No, I think we covered a lot of ground, certainly. But, again, just, want to stress that this is, I think it's a wonderful program. Obviously, I've been in the industry for a long time, but I think it's a tremendous program and a tremendous opportunity. It's really a wonderful resource. It's a wonderful organization. The concept is great. And I'm personally, I'm excited to, be involved with the families that, through this program, again, to help them, do the things that we talked about, which is just kind of get, better finances underneath them. And hopefully, again, start to establish a bit more understanding, education, trust, and those types of things with the financial world so that, again, as you're getting better physically through your treatments at Boston Med, through this consulting program offered in conjunction with that, you can emerge in better financial shape too.
That's wonderful. Thank you again, Rob. We are really grateful for your time and expertise. And excited to see how this works out for our patients as you work with them. So we're going to wrap up now. But again, if you're watching this, if you're interested in financial coaching or one of our other services, you need to file your taxes, you haven't gotten your stimulus payment, you want to open a 529 savings account for your kid, send us an email at info@mystreetcred.org or call us at 617-414-5170, and we will get you set up with the services that you need. So thank you for watching, and we hope to hear from you soon.